Good afternoon, everyone. Welcome to my page, Dr. Rekha Sehgal, Homeopathy for Mankind. Today, I'm going to share a very important topic that is sunstroke or heat stroke because a lot of patients in our clinic are coming with this problem. So, before starting this, explaining the condition, I would discuss a very short case. This was a case of a girl who is 5 years old, came to my clinic in the morning OPD, and she came to us for a regular follow. So we prescribed the medicine. The moment she's back to the home, her mother called up me and she said that she's running down with a very high fever. So I took the totality on the phone only, and even the mother was confused that why the child was so hale and hearty, and suddenly all the problems have been erupted. She was having a very hot skin, and the temperatures was 102 degree Fahrenheit. Then she was having a pain in abdomen, she was unable to sleep, she was having a very severe headache, and with this headache she's continuously crying also because of this headache. So I prescribed belladonna 30 as I consider the pace, the onset of the problem, and the causation was exposure to the sun. So to give it in a frequent intervals and to report me in the evening. So she called up in the evening and she said that now the child is okay, she's not having any problem, and she's playing again and resuming her regular activity. So I asked her to stop the medicine. So as you all know, the condition was sunstroke because the child was exposed to the sun, and this condition is very common nowadays because temperature is soaring very high, and in many places it is crossing more than 40 degrees centigrade. So what is sunstroke? Sunstroke is basically an illness which is caused by the sudden exposure or sudden elevation of the body temperature because of your exposure to the hot environment. The body temperature could raise up to 104 degree Fahrenheit or 40 degrees centigrade. So what are the causes of this sunstroke? Basically, the first and foremost is exposure to the sun for a pretty long time, or you are working in such a condition where you're exposed to the hot environment, or the people those who are in a having a dehydration. The fourth is the people those who consume a lot of alcohol, and the people those who wear a lot of clothing. So these are some of the causes. Now what are the risk factors involved? First is foremost, as I've said, that the children which are below age 5 and the old age people, those who are above 65, are prone to this problem. The reason is that in children, as you all know, the central nervous system is in a developing stage, so the body could not adapt to sudden fluctuations in the body temperature. And for the old age people, the CNS, the central nervous system, is in a deterring stage, so they cannot the body mechanism is unable to adapt. So the people, the children below age 5 and the old age people above 65 should take utmost care during this environment. The next, the people those who are on medications like antidepressants, the sedatives, antiallergics, and antihypertensives, they are also prone to have this condition. Or the people those who are having a long history of any heart related ailments, the lung diseases, obesity. Then there are the people those who are exposed to the conditions where they are working for a very long hot environment. So these are certain risk factors which are to be considered while taking the case. Now what could be the presentation with which the patient can come to your clinic? There could be a variety of presentation. It could be from mild symptoms to very severe symptoms. The mild symptoms could be the red hot skin, the increase in the body temperature, then there is a headache, the vertigo, the weakness, fatigue, and the vomiting episode, or there could be the confusion of the mind. They are unable to concentrate, they don't want to relate with the people, there could be slurred speech, and sometimes the conditions could lead to a fainting episode or in chronic some complicated state, it could lead to loss of consciousness or even coma. So you have to be very careful in dealing this situation. You have to be very quick. You should know your scope and limitations, when to prescribe the medicine, or what kind of emergency measures are needed. So you have to be very quick in prescribing them, and the condition can be treated very well with homeopathy. Now, these are the variety of symptoms which I have described. Now, what could be the preventive measures? The preventive measure is one, and first and foremost is that to avoid exposure to sun. And if it is not avoided, then use proper measures to protect your body. You can use sunglasses, you can use umbrella. Even if you're working in a hot environment for a pretty long time, take take a break and rehydrate, hydrate your body, consume a lot of fluids, because it will avoid the dehydration state, which is one of the foremost cause for sunstroke. So you have to keep your body in a very hydrated state in order to prevent from this situation. Now, the homeopathic part, which is very interesting, I'm going to discuss 6 7 medicines which are very relevant and which suits the totality. The first and foremost, which I have prescribed in my case also, the belladonna. The belladonna is prescribed in which, where you will see the patient the condition is developing in a very fast pace. The onset is very, very sudden, and you will see a lot of burning. There is a red hot skin, there's a lot of congestion, the uh, the redness is masked, the hotness is masked, the hyperesthesia of the senses is marked, the sleep pattern you will see, these all are conditioned in a very fast pace. So belladonna is prescribed in those cases. The second medicine is gelsemium. I will prescribe it in a 200 potency as a preventive for sunstroke also. It can be a preventive medicine for sunstroke, and with this medicine you will see the pace is usually very slow, and with this the patient is in a very dull state. There's a lot of apathy is there. The patient doesn't want to talk to anyone because there is a general depressive state of the mind is there. He doesn't want to relate, wants to lie down quietly, doesn't want to relate with the people. With this there is a lot of thirstlessness is there, and the body is in a very sore state. There is a lot of pain is there, and he wants to lie down completely. So that is total opposite of belladonna. The third medicine is natrum carb. It is a medicine, a very good effective medicine, which is prescribed for chronic effects of sunstroke. And with this, you will find a lot of weakness and debility is there. So the patient is in a very dull state. There's a lot of fatigue is there, weakness is there, there's aversion to do the work. The next medicine is glonine. Glonine is prescribed in those cases where you see a certain furious picture where the patient complains of a very congestive headache, and the headache is so severe that as if the whole blood is rushing toward the head, and the headache is in a violent state. The patient is unable to do any work, and he doesn't want any covering around the head. And you will see in very complicated cases where the patient is in a stretcherous breathing is there, or there is a rapid heart rate is there, there's a fixation of pupil. When you see the complicated stage of sunstroke, their glonine works very well. It has to be prescribed in a frequent repetition is there. The next medicine is Nux vomica. Nux vomica, it is prescribed where you will find definitely there is an ailment factor of excessive consumption of alcohol or drugs. Those people, those who are dependent on the drugs, plus their mental state. The mental state, you will find there is a lot of irritability is there. The patient doesn't want to talk to anyone, and he's very irritable because of going to the sun. So these are the biochemic preparation natrium U6X I have prescribed to many children before going or moving out in the sun, because sometimes it is unavoidable and you have to go. So natrium U6X in biochemic form works very well. You can prescribe a single dose before going to the sun. So these are certain medicines which can be very fruitful in treating this condition. If you have any query regarding this problem, you can my number is displayed on my page. You can talk to me, and the online consultations are also available for this problem, or other problems also. I hope this video could be beneficial to you. Thank you and have a very nice day and a World Health Day. Congratulations to all of you. Thank you.